Do you remember getting alphabet soup as a child? I remember getting it and lining up all the letters just perfectly. I guess that shows my autism. Anyway, I have noticed that there's a lot of alphabet soup surrounding autism. A lot of letters to figure out. This is the Independent Autistic. Let's talk about some terms. Alphabet soup and autism. First, ASD. This stands for Autism Spectrum Disorder. This is a big grouping of all the autistic challenges, traits, and people. AS, Asperger's Syndrome. This is an old term that is no longer used, mainly to speak of autistics that have few support needs. The term was rolled into ASD, Autism Spectrum Disorder, the category that is in the new DSM-5. Speaking of, the DSM-5 is the Bible of the psychology world. Every disorder or mental difference is noted. This is a psychiatric manual. It is the kind of go-to place, the gold standard, if you will, of autistic diagnosis. It is the source of the official diagnosis criteria. CBT, Cognitive Behavioral Therapy. It is a form of psychotherapy that helps individuals manage a wide range of mental conditions by focusing on the relationship between thoughts, feelings, and behaviors. ABA can refer to a few things. Most commonly, it stands for Applied Behavioral Analysis, a scientific approach to understanding and changing behavior. This is often the most common type of therapy given to autistics, with rather mixed results depending on who you ask. ADHD, Attention Deficit Hyperactivity Disorder. Traditionally described individuals primarily struggling with inattention. AUDHD, Autism and ADHD together. Approximately 20 to 80% of individuals with autism spectrum disorder also have ADHD. Please remember to subscribe for more autistic content. HFA, High Functioning Autism, was historically an autism classification to describe a person who exhibited no intellectual disability but otherwise showed autistic traits, such as difficulty in social interaction and communication. The term was often applied to verbal autistic people of at least average intelligence. High-functioning autism is a colloquial term used to describe individuals with ASD who do not have a co-occurring intellectual disability. This term, I think, is somewhat misunderstood. These autistics are still very much autistics and have more in common with other autistics who need more support than non-autistics. And further, high functioning is kind of a crazy name because I'm high functioning one day and low functioning the next. And so are many autistics. Normie. Normie is a term that refers to the non-autistic population or neurotypical population, in contrast to the neurodiverse population. Neurodiverse is a category that includes autism as well as other conditions. ASPI. ASPI is short for Asperger's Syndrome, and it is in effect the name we gave ourselves. So many of us autistics will also say we're Aspies. Stimming is an informal term short for the clinical term self-stimulatory behaviors. What a mouthful. And refers to the repetitive behaviors or motions that a person does, such as a person flapping their hands or biting their nails. Stimming is done when someone is feeling overwhelmed, as a way of focusing on one activity. While stimming is not exclusive to the ASD community, the behavior is far more common and sometimes disruptive in this population. But oh, does it feel good to us autistics. The levels of autism. All the levels of autism are bona fide autism. You're not a little bit autistic. And in all of these cases, autistics are more similar to each other than to the normie population. Level 1, requiring some support. Individuals on this level may be able to live independently with some support. They may need assistance with social situations, understanding social clues, or managing daily tasks. Examples include difficulty initiating social interactions, atypical responses to social overtures, and noticeable impairments in social communication without support. This level was previously referred to as high-functioning autism or Asperger's syndrome, but these terms are no longer used. Level 2, requiring substantial support. Individuals at this level require more substantial support for daily functioning and may struggle with social interactions. They may have challenges with verbal or nonverbal communication, reduced or abnormal responses to social cues, and difficulty coping with change. Examples include marked deficits in verbal and nonverbal communication and noticeable impairments, even with support. Level 3. Level 3, requiring very substantial support. Individuals with this level have the most severe challenges and require very substantial support in most aspects of daily life. They may have significantly difficult verbal and nonverbal communication, limited ability to initiate social interactions, and minimal responses to social overtures. This level is characterized by severe social communication deficits and significant impairments in functioning. If you found this video helpful, check out my playlist of successful autistics. Offer the customary sacrifices to the algorithm God. This is the Independent Autistic saying, I see you, I hear you, I love you, you're not alone. You were born different to make a difference.